choice to have LASIK surgery will be one of the most important decisions of your life. Hi, I'm Dr. Gus Stern. I have performed over 3,000 LASIK procedures here at Vision Care of Maine, Mann Eye Center in Houston, and now my own center in Hagerstown, Maryland. My greatest thrill is when the patient gets up from the chair immediately after the procedure and can see the clock on the wall. We are proud to have the opportunity to provide this care to you. LASIK is not only a surgical procedure, but is also a process. Today we're going to talk about the process and the steps involved. You will also get to meet patients that have had this procedure and hear about the experience both in their care and their vision.
And I am a tennis player. I've been a tennis player since I was little. My parents are tennis players, and I really want to play tennis without glasses because I was wearing trifocals. And it's like, okay, where's the ball? Where's the ball? Where's the ball? And to think that I can see the ball without having glasses slipping up and down my nose, and which section of my trifocals I'm trying to find the ball in. So I can't wait to get on the tennis court again. I'm really looking forward to that. And so just being an active lifestyle, being able to see, and I'm just very excited about it.
LASIK is an extremely successful procedure. Greater than 90% of our patients are better than 20/20, and greater than 96% of our patients require no dependence on glasses to drive a car. Often this is achieved on the very first day after surgery. However, individual results may vary, and no LASIK surgeon can guarantee 100% that you'll be free from glasses.
I became interested in LASIK when I heard an ad on the radio and just started mulling it over in my mind of how nice it would be to be without glasses, since I've been wearing them since I was 9 years old. And I just thought about it, and then I talked to a friend who had actually been to this facility for an eye injury, and she raved about the care that she...
During your evaluation, you will have a very extensive eye examination. You'll be heavily dilated, so you should bring a driver and sunglasses with you. Among other things, we get a topographic map of your eye and several manual measurements of your eye. All of these measurements are designed to produce the most accurate representation of your eye and formulate a custom treatment plan for you.
Actually had the test in a week, 2 weeks prior to, because I had to take medicine. And I was impressed myself. I forgot to ask Martin how long it really took when he had come. And so I was expecting to be out, 45 minutes to an hour. That's not the case. And I'm glad it's not the case because it was thorough. I literally was here 2 hours and 20 minutes, and I had numerous tests. I went from one station of testing, looking at, the pressure of my eyes, to another station, which I'm not sure, but it was, they were doing their things. Then I went in the room and I had numerous eye drops, dilation, making sure that I could pass, that I could have the surgery, that my, my vision, the criteria was there, was I a good candidate? And throughout the whole process, it was like 2 hours and 20 minutes and I wasn't really sitting for very long. I would go from station to station, and it was thorough. It was very thorough. I was very impressed. I have never had an eye exam at this length ever. As a matter of fact, I asked if people come for normal eye exams here. I have gone to an eye doctor down in my area, and I must tell you, I am contemplating on switching because of the thoroughness that I found and experienced even for this procedure. However, I will say that I have talked to other people who come here for just regular eye exams, and they're very thorough. In my case, I'm usually in and out, and that's not the case. They take the time, is what I hear, and it's very thorough. So I really am very impressed with the facility, and the doctors are amazing.
Before we get started with an explanation of the procedure, I would like to tell you about its limitations. We cannot guarantee you 20/20 vision because every patient is different. An extremely high prescription, high astigmatism, or other factor may limit your vision after surgery. Every surgical procedure involves risk. However, our risk is extremely low, and over 96% of our patients require no dependence on glasses. But we cannot guarantee that you will be glasses-free after your procedure. We will discuss your risk on your preoperative evaluation. You have a choice of two very different flaps for your surgery. They are both very safe, however, one exceeds the other in the quality of the outcomes and the precision of the flap centration. The flap procedure I'm referring to is Intralace. Intralace is the latest generation of femtosecond lasers. A femtosecond laser is a fraction of a second. Actually, the speed is a decimal followed by 15 zeros and then a 1. The laser is a cool beam and you will not feel any discomfort from the laser. It is the most precise way to make the flap perfectly centered on the treatable surface of your eye. This method is chosen by 99% of our patients.
I'm doing it. I want to do it for Kayla. I want to do it for myself. I want to do it so I can see crispy clear. And I've never been able to wear sunglasses without, if I had contacts and I couldn't keep them in very long. They bothered me. So I never really had the experience of putting on a nice pair of sunglasses and being unable to see.
I chose Interlace because it's bladeless. I think it was just in my mind that anything bladeless might be a little bit better. A blade in my eye, I guess that would make me a little apprehensive, so.
After all your testings and evaluations, it's now your big day. We ask that you wear comfortable clothes and wear no makeup, deodorant, or perfume. These items can interfere with your healing process and affect the laser accuracy. Remember, the laser is so precise that we are able to sculpt a human hair with it. So any airborne interference could affect its accuracy. You will be given a mild sedative to relax you, and then your procedure will begin. After your procedure, we will check your vision. It will be foggy, but you will be able to see. From there, you will go home and take a nap. Sleep is the best thing for you after your surgery. Take care to wear your shield and to not rub your eyes. When you wake up from your nap, you will begin your drops.
1 week after surgery, I'm seeing really well. I'm very, very happy. One eye is definitely clearer than the other. And after just seeing the doctor, I'm feeling confident that it's just going to get better. Because there is, after you do something, a procedure like this, there's irritation, there's inflammation, and basically you need to do, if you have this procedure done, you have to follow the post-op directions. You have to go home and rest your eyes. You have to do what they tell you to do if you want a good outcome. And that's what I did. And I'm prepared for a good outcome because I'm going to continue to do what they tell me to do.
About 4% of our patients require a touch-up or enhancement. The reason for this is that each person heals differently. The enhancement risk slightly increases in patients with large initial prescriptions. We carefully monitor your healing process after surgery. Enhancements, if they are needed, are generally done 6 to 12 months after your initial surgery.
Like I said, I'm a medical professional, and I've worked in the hospital situation and I work with people all the time, and I'm just comfortable in the healthcare setting. And again, they were just so professional. They educated me on every step of the process, and they were, they had a good sense of humor, and I felt very relaxed, and of course the Valium helped. It really helped get there.
I am seeing wonderful. I came in on Saturday, and when I had my visit before, we did not know if we would ever get 20/20. And I was okay with that because I had really bad vision to begin with. And I have been wearing glasses since age 6.
The doctors are, every single one that I've met and that has taken care of me, spectacular service, great attitude, personable, loved it. I mean, just great, just fantastic. Very happy with that, really happy with that. So I'd come back. I'm definitely coming back here. Very happy with the service.
Thank you for choosing Maryland Vision Institute. I hope that this film has answered a lot of your questions, and I hope it has provided you with enough information to have an informative discussion with your doctor prior to your LASIK surgery.